Hey everyone, and welcome. Today, we're going to pull back the curtain on something you've probably never thought much about, the hidden science of dental safety. We're going to explore the incredible journey that ensures every filling, crown, and implant is actually safe for you. So, let's get into it. So picture this. You're in the dentist chair, you're staring up at that funny light on the ceiling, and that little thought just pops into your head. Is this stuff they're about to put in my mouth actually safe? You know, it's a totally fair question, and the answer is way more fascinating than you might think. You see, the absolute first rule of dentistry, the foundation for everything they do, is super simple. Above all, do no harm. And this doesn't just mean for you, the patient. It means any material they use has to be completely safe for the dentist and assistants who are working with this stuff day in and day out. This is the bedrock of dental safety, for sure. So what does that perfect dental material look like? Well, think of it like a checklist, the holy grail for a new material. It has to be non-toxic, of course. It can't be an irritant. It absolutely can't have the potential to cause allergies or, even worse, cancer. And maybe most importantly, it has to be harmless to the living part of your tooth, the pulp. This is the gold standard they're always shooting for.
Okay, so how do scientists and researchers make sure new material actually hits all those marks? Well, it's not just one quick test, not even close. It's more like a three-level gauntlet that every single material has to survive. And trust me, each stage gets tougher and tougher.
The whole journey starts in the lab. Step 1 is screening, basic tests to see if the material is toxic right off the bat. If it passes, it moves on to Step 2, animal trials. These are usually limited tests in animals like monkeys or ferrets to see how it behaves in a living system. Then, and only if it clears that stage, does it move on to the final boss, controlled clinical trials with actual human volunteers. All right, time for a quick pop quiz. What's that final, most absolutely critical level of testing before a material ever gets approved to be used on you? Come on, you know this one. If you said human trials, you are absolutely right. That is the ultimate test for both safety and for seeing if the stuff actually works.
Now, we've talked a lot about patient safety, and that's obviously priority number one. But there's a whole other group of people we have to think about here, the dental professionals themselves. For dentists, for their assistants, for the lab techs, the risks they face are often way, way bigger.
Just think about this for a second. As a patient, your exposure is maybe a few minutes once or twice a year, and it's to a material that's already set and stable. But for the dental staff, they are exposed to these materials all day, every day for their entire careers. And what's more, they're often handling them during the mixing phase when the materials are at their most reactive and potentially hazardous. It's a whole different ballgame.
This long-term exposure is why strict safety protocols are so important. A perfect example is mercury from old amalgam fillings. While the risk of inhaling a tiny bit of mercury vapor is minimal for you as a patient getting a filling, it's a huge deal for the dental team. This quote says it all, right? That's why things like mercury hygiene are a standard practice. It's all about protecting their health in the long run.
But here's where things get a little tricky. Even with all this insane, rigorous testing, there's a complication. And it's a big one. Everybody's body is different. And that means a material's safety isn't always a simple black and white issue.
So let me ask you this. Is it actually possible for a material to be perfectly safe for, say, 1 million people, but then cause a problem for person number 1,000,001? The answer is a resounding yes. And that brings us to a really key idea in all of medical science.
And that idea is called relative biocompatibility. Okay, sounds a bit sciencey, but it's actually pretty simple. Biocompatible just means it gets along with living tissue. But that word relative, that's the key. It means a material's safety depends on the individual. Think of it like a food allergy, right? Peanuts are perfectly safe for most of us, but for some people, they can be really dangerous. It's the same principle. A dental material can be totally fine for millions, but cause a reaction in a very small number of people.
So, since no material is 100% perfect for every single person on the planet, how do dentists choose what to use? Well, this is where their real expertise comes in. They have to do a very careful risk versus benefit puzzle for every single patient.
And you might think, wait, why would they ever use a material that has any risk at all? Well, there are a few really important reasons. It might be that the risk only applies to a teeny tiny fraction of people. Or sometimes there just isn't a better alternative available that does the job as well. But the ultimate deciding factor is always this. Does the benefit to the patient's health massively outweigh any potential risk?
And that right there is the key takeaway. The choice of what material to put in your mouth isn't a one-size-fits-all decision. Not at all. It's a personalized medical judgment. It's a risk-benefit analysis tailored specifically to you and your unique health situation.
So, the next time you find yourself in that dentist chair, just remember the incredible science that's at play behind the scenes. Knowing about this whole intense process, the testing gauntlet, the risk analysis, does it give you an even greater appreciation for your dental team? It's definitely something to chew on. Thanks for tuning in.